I decided I wanted to be in the Air Force very early in my life. My father was an Air Force physician, my godfather was an Air Force physician, and for as long as I can remember, that's all I wanted to do. I really like working with my hands, solving problems with it. Surgery was the avenue of medicine that most appealed to that, but I've always been strongly attracted to biology, science. It kind of fits my personality. I applied to the Air Force Academy out of high school. Once I got accepted, then the path was set. The Academy did an excellent job of preparing me. Most of the classes I took for upper-level biology mirrored what I took in the first 2 years of medical school. And being able to get into a structured environment, so when I did get to medical school and it was me generating my own schedule and making sure I got to class on time, I think that was probably the biggest benefit. And then from the Academy, I got into the Uniformed Services University of Health Sciences in the DC area. I first realized the caliber of education that you get in the Air Force when I was in medical school, especially the third and fourth years as we were out on our rotation. You got to interact with residents and medical students who trained elsewhere, who went to school elsewhere. And as I told people in my family and people who were interested in medicine at that time, I couldn't be prouder and happier in my education as an orthopedic surgeon. I would take my classmates and myself over some of the bigger institutions in the United States as far as skill level and knowledge level. Being a physician in the Air Force, and patient care is always number one. The worries about how to go about paying for something, how to go about obtaining either supplies or medications for the patients, very limited, if present at all. When I'm talking to my junior partners who've just come into the Air Force, I tell them that being an Air Force orthopedic surgeon is going to be the best time of their life. You have plenty of time to get your practice established. You have plenty of time to develop yourself as an orthopedic surgeon, but most importantly, you have plenty of time to get to know your family again. A lot of times we lose sight of that when we're in residency. We're working day in, day out, 18 hours a day sometimes. We're on call every other night, and we don't get to see our families much in that 4 or 5 years we're in training. The first couple years out of your practice, you got that opportunity to get that connection reestablished with your family, and that's probably one of the biggest things I tell my partners. Some of the best parts about being an Air Force physician are the patients we get to treat. You get to talk with people who've been in the military since World War II, Korea, Vietnam, and to hear their stories and to hear the heritage of where I'm at right now is just, you can't get that on the outside as a civilian physician. Very proud. I've had a couple of opportunities to be deployed and operate on our service members in a deployed environment, saving lives, saving limbs, and it gets you. I'm Lieutenant Colonel Paul Gleason. I'm an orthopedic hand surgeon in the United States Air Force, and I'm from an Air Force family, so I'm from everywhere.